Hi, my name is Jade Curtis, your favorite host for BDO's newest video series, The Pulse. I'm here with Dr. Redmond. Can you please give us a quick introduction?
Sure, yes. Hi, I'm Dr. Crystal Redmond, they, she pronouns. I'm a public health doctor and I work in a few different fields. I'm an executive director of Spark Reproductive Justice Now in Atlanta, Georgia, where we focus on reproductive justice for Black folks. I'm also an adjunct professor at Emory Rollins School of Public Health, and I just started my own public health research and science institute, SAGE Institute.
Wow, nice.
Yeah.
Congratulations on that.
Thank you.
It's amazing. So are there any key areas that we should focus on in terms of reproductive health right now?
Yeah, I think some of the major key areas is really focusing on reducing our maternal morbidity and mortality rate. A lot of the issue is not just access. It doesn't just start with someone having access to care. It's also around culturally humble care, beyond cultural competency, but culturally humble care. Realizing that our health outcomes are not just individualized, they're communal health outcomes and disparities because injustices within systems. So how do we really tackle that? How do we address, dismantle, disrupt, and rebuild systems that truly serve us is a conversation we continue to need to have in order to really talk about the deeper rooted issues of why we're seeing these really poor health outcomes in our communities over years.
Absolutely. Yeah. And especially, and I know you mentioned that you were down in Georgia and I'm down in Georgia as well. I live in Atlanta. Yeah, I know, girl. So, but one of the things that has been top of mind for me over the past few weeks, months is the young woman who is brain dead in the hospital and they're keeping her alive. Do you feel comfortable touching on that?
I feel comfortable and also out of respect for their family, because our organization, as well as so many other reproductive justice partners, are galvanizing around the family to support them and not just like their emotional needs in the really horrible situation that's going on, and also like just respecting the fact that it is a lot that's bared on the family and it has everything to do with the legislature.
Absolutely.
Policy. And in Georgia, we have HB 481, which is a anti-abortion bill, essentially a 6-week abortion ban, and that has direct effects on folks who just seek to get care. And in this situation with Adriana Smith, it's deeper. It has deeper roots because she went to the hospital seeking care, saying that, she was in pain. And unfortunately, because of systemic oppression, because of racism, they didn't believe her. Because as a Black woman, we're not believed. We're not, our pain is not taken seriously, and they didn't believe her, and they didn't investigate more. There was no curiosity into investigating her body and her concerns. She was discharged with medicine, pain medicine. The next day, she went back to a different provider and they identified that she had severe health concerns that there was no treatment option for. So within a short amount of time, she was pronounced brain dead. And, out of respect to the family, she has a young son that was not aware that his mom had passed. And because of the state of Georgia, she was left on life support. And essentially her body was used as an incubator to grow this fetus until the baby was considered viable enough to be delivered. And the baby was delivered, the baby was extracted from her body. Let's say that, because
I didn't know we got an update. Wow.
And this was, don't quote me on this, but just about a week or two ago or so.
Whoa.
Yeah.
Okay. Wow.
So then there's conversations around the ethics of it all, care for now this baby that's in the NICU, and I won't touch on their health status because I don't know too much information about how the baby is doing, but it's just a very layered conversation.
Yeah. I really appreciate you sharing more information about that, because a lot of people have heard about it but haven't really heard much. I didn't even hear about the latest update. So thank you so much for sharing that and being respectful about it as well. And so I think what feeds into that is just about advocacy, right? And so if you could share some tips about how women, and I know sometimes a situation is a situation, but are there any tips that maybe we can kind of start taking control? How can we start advocating for ourselves? How can we make sure that we're heard? How can our family members, if you had any tips to share, what would they be?
Okay, so one is just knowing your power. We have so much power, but I think because the systems that are truly bearing on us, it gives this perception as if we don't have power, and the power is within the system. The systems have the power over us. So just reminding ourselves of bodily autonomy. If we're not being heard by that provider, continue to seek care somewhere else. And I know that is very layered because a lot of us don't have options to go down the street to the next hospital. Some of us live in health desert, hospital apartheid. I think that's what it's called. So resources are limited there. But I will say, bringing someone into your appointments just to be your advocate, writing down questions you may have. And if you're not quite sure of the questions you're going to have, maybe just like partnering with a local community organization that works directly in patient advocacy, that works, directly in showing up and showing out for people who are going to see their providers and just need that emotional and like tangible support. So I think that's a good start, just bringing someone else into your appointment where you feel comfortable and seeking support from a grassroots communal organization.
Absolutely. And then is your organization someone that people kind of reach out to for something like that as well?
So our organization, although we advocate on a large scale, really building communal power, collective power, grassroots organizing, and health education and information and such, we also partner with other organizations that do offer those type of services. For instance, I believe in Georgia, there's ARC Southeast. They're an abortion fund too as well, and they do provide supportive services for essentially patients who are seeking care and need support in that way. But there's a few other organizations in Atlanta that offer that patient advocate service.
Awesome. That's amazing. And as we're editing this video, we'll add those down at the bottom, something similar, so that way people have access to those things, just so you guys have access. My next thing that I wanted to talk about with you, we touched on abortion. And I know in Georgia, I'm down in Georgia, as I've mentioned, there's 6 weeks, right? So for those who maybe don't find out in that time, or what are their options there? What should they consider? Should they be concerned? Like how do you, without getting in trouble, without doing something illegal, how do you make a decision for yourself? What are your options and how do you weigh those options?
Yeah, so I know that there's a narrative of if you don't have access, like if you're beyond the 6 weeks and you are unable to seek an abortion in Georgia, and just like drive to the nearest state or get on a plane and go to a state that allots for that particular service, right? And that's not the reality for folks who just can't, right? We can't afford it or just don't have the support system we need to like do that, right? So it's not an easy option. And also there are like mutual aid groups and such that galvanize mutual aid funds and support to help folks to get to where they need to go. So getting connected to a reproductive justice organization in your local area is vital, not just like for accessibility as far as like funds for care, but also just support, making sure that you can receive those care in a very safe way, and safe in regards to like being protected or being gathered around people who will make sure that you are not only accessing the care, but doing it in a way that doesn't jeopardize your freedom. So I would say that's like my main point, like get connected to reproductive justice organizations.
So stay in touch. So we got to find them. Okay. And then on top of that, I can hear the passion while you're talking about these things. And it makes me curious, how did you get into this? And what makes you so passionate about this?
Yeah. So as far as reproductive justice, I was so into reproductive justice without even knowing what it was. Like I didn't even know that there was this, big RJ movement for me, but I say I was so into it because of my identities. I'm a Black woman, and there's multiple identities even within my Blackness and even within my womanhood. So being born and raised in LA, I have always been an abolitionist. I believe in dismantling, disrupting, rebuilding, and dreaming about systems and things that really serve us. So in that, that's my political lineage. Like, how can I don't know if I curse on your network, but mess things up,
Absolutely.
Fire things up so much and everything in a way that like really begins to like just shift things for us. So for me, that has been my core, and I've taken that passion, so to speak, in my whole like medical journey, in my journey towards like not just reproductive health, but like justice, like truly justice. Like what does that look like beyond, right? So when I moved to Atlanta, I started getting connected with grassroots organizations, and I fell in love with reproductive justice. I'm like, this is the thing, like this is naming the thing that I truly felt was missing. Reproductive justice has been around for so long, and it really highlights the fact that like reproductive oppression is there. That is the gap, right? Like reproductive justice is not cute. It exists because people are dying and people are falling within those gaps. So like, what is the difference between reproductive health and rights? Like that justice piece is so important, and that's how I fell in love with it. That's how I met it, coming to the South and understanding like the caveat between oppression and like that gap of what is needed.
Absolutely. And I feel like with everything going on, as you mentioned, the abortions, with Black maternal health still being an issue, there are so many people who are just as passionate as you. And I know you mentioned your journey, but what are some other ways that people can kind of dive into this space, who want to speak up, who want to advocate, and even those who maybe don't want to be so actively in the space, but how can they make sure that their voices are heard so we can start changing those outcomes even more?
Yeah. Okay. So first and foremost, our stories, our lived experiences are qualitative data. Storytelling is data. The way we carry stories within our families, within our lineage, throughout our bloodline is so impactful, right? And how do we document those things wherever people feel comfortable? Is it on social media where you're creating posts and reels and getting out tidbit information, explaining your story, your journey, resource sharing? Is it at the Capitol? Are folks comfortable with being at the Capitol and calling out legislators or what have you, volunteering, showing up for your neighbor, resource sharing, whatever it is, right? Because our entry point is so diverse, right?
Yes.
I'll also say is wherever you're already at, if you are a hairstylist, how can you show up in that space and really begin to have communal conversations? You don't have to be a public health doctor, a medical provider, public policy person to be interested and involved in movement space, in public health, or in just collective social justice movement, but show up wherever you're at, to show up, galvanize people, have conversations, document those conversations. That's how we build collective power.
Absolutely. I love that. And one of my favorite things about doing these interviews is one of the key themes I hear is just talk. Just start the conversation, spread the word. However you can do that, just start the conversation. So I absolutely love that. I want to thank you so much for your time. You have shared so much information. And
can I add one more thing?
Absolutely. Absolutely.
I would have one more thing. So sorry to that point.
You're good.
One of the things with talking is even prior to COVID, I know a group of myself, my colleagues, and just folks in community were talking, and we're we don't have a space where Black doctors can just have a conversation on a panel, right? Outside of conferences. And this is way before podcasts started becoming big and such. But, we knew that there were so many things going on, not just politically and culturally, but in public health, that just there was this gap of lack of information, consistent information. So I created a talk show, our panel talk show, TV talk show and everything. And it's literally a part of that conversation you were saying, how do we continue to just have conversation, and the power of that. And that talk show is literally just Black doctors sitting there and talking, right? And it's called Our Panel because it's not just Black doctors. We bring in folks in community to continue on and hold power in those conversations. So just, naming that, it doesn't have to be this mega platform. It can literally be hey, design something, sit there and talk.
Love that. And you know what? I really appreciate you doing that as well. And make sure you tell us where we can find you for that. So go ahead and plug yourself for it.
Okay, so you can find Our Panel Talk Show at Our Panel TV. And also in regards to the SAGE Institute, if you're interested in joining the public health think tank or the health executive think tank, we have 2 cohorts going on, and you can find it at drkristaredmond.com.
Well, thank you so much for your time. This was a fantastic conversation, and I'm sure it will make just as much impact as your show, as blackdoctor.org. So thank you so much.
Thank you very much. Take care.